he was amazing what he did to me. He changed my life, and I ended up, playing college football after that, and decided that's what I wanted to do because I thought it was just amazing how somebody could help somebody just with their hands, without the use of drugs or surgery.
All right, great. So this is another one of our episodes. This series of episodes are being done with the purpose of making chiropractic treatment mainstream to make people understand what chiropractic treatment is and get with it because it's an amazing type of physical help that just it helps us a lot. It helped me a lot when I really needed it, and that's another story to tell another day. But if it wasn't because of chiropractors like our special guest that we have today, I wouldn't be here able to talk to you guys and enjoy my life. So today, without further ado, let me just introduce our very, very special guest. He's a really cool guy. He helps a lot of people. He has passion driving him every day to do what he does. So this is Dr. Robert DeVincentis here with us. Doctor, say hi.
Hello, everyone. Good to see you.
Doctor, I'm so happy to have you here. You look so happy.
Yes, very.
So, Doctor, please tell us a little bit about you, like how you became a chiropractor and why you like it so much.
Well, I think it's fabulous. For me, it helped me when I had an injury. I had fractured a vertebra in my neck playing football when I was 15, and I had went to many medical doctors. They didn't know what to do with me, just give me pain meds and was just confused. And so my mom actually sent me to a chiropractor, and within 3 or 4 visits, after the bone had healed, I still was having issues, but he was amazing what he did to me. He changed my life, and I ended up, playing college football after that, and decided that's what I wanted to do because I thought it was just amazing how somebody could help somebody just with their hands, without the use of drugs or surgery.
It's fantastic how chiropractic treatment helps you so much without needing drugs or without needing surgery. I think that is amazing because otherwise I would be taking painkillers the rest of my life, and that's not cool.
I think nowadays people are starting to realize that that's not the answer. That doesn't fix the problem. It just merely masks the symptoms with a lot of side effects you have to worry about. Our parents and older generations, it was the modern age of medicine where there's pretty much a pill for everything. And through time, we've evolved and realized that, hey, that's maybe not the best answer. The body's meant to heal itself. And what chiropractic really does is provides an environment so that it can heal itself. And the proof's in the pudding. When you treat somebody and you feel better immediately, it's wonderful. So.
Yeah, it is. I definitely agree with you. And let's say, how many years you've been practicing for now?
For 25 years I've been in practice, so it's been a long time. I don't even
Wow.
not work. That's a very full job I have, helping people each day. People that were losing hope, and just very sad to see that they had no other, nothing else was making them better, and I was their last resort and was able to change their life. More quality of life, and then just turn it around, prevent surgeries, and get them happy, get them living life to its fullest.
That's fantastic, Doctor. And how many, like in the course of 25 years, what would you say are some of the myths that you've found that people have about chiropractic treatment?
Yeah, one big myth is a lot of people feel that once you go, you always have to go. And that's not necessarily the case. When people come to me, they have a specific problem. I try to fix people least amount of visits, quickest amount of time to get them better for that particular condition. Now, I will at some point recommend, once we get them better, what's called maintenance care, where basically once a month they come in and we check them, determine if there's an adjustment needed, because that's more preventative. Just like going to the dentist to make sure the teeth are straight, make sure the teeth are clean. The problem is when we wake up in the morning, we don't see our spines. If we did, we probably take care of it. We look in the mirror, we see our teeth, It's like, oh, I got to take care of this. But our spine's very important, and it's spinal health is maintenance. But like I said, I don't force that on patients. It's their choice. I get them better through the particular condition, and then give them the recommendation to do once a month, and that's up to them. So.
Okay, good. So once, let's say I go to you, you like fix me up, get me all good. And like, depending how bad I am, let's say it takes me about somewhere between a month to 3 months to get me, healthy again. And then after that, I should go back to you for about once a month or something like that, just to make sure that I continue having my health the way I should, right?
Yeah, that's what maintenance is, once a month. And here's the hardest thing to understand. I kind of relate it to when your body has a heart condition. The arteries that feed your heart slowly start to close off. You don't feel nothing. When pain comes, it's too late. So it's very common in chronic conditions, especially the spine. I treat a lot of bodybuilders. They work out in the gym for many, many years, never have a problem. And then one day they're brushing their teeth, fall to the floor in back pain. They come see me. I do X-rays, and then they have arthritis and all these problems that have been going on for many years, even though they didn't have symptoms. So the point is like, I wish I saw those people years ago, could have prevented, many of the problems that they have. So, it's kind of related to having a heart attack. When you have a heart attack, it's too late. I wish, you should be eating properly, exercising, not smoking, many years before that, the heart attack happens. Because when the heart attack comes, that's the last warning sign. In a chronic condition, in an acute condition, you sprain an ankle, pain's first, and it. So, but unfortunately, with many spinal conditions, you don't feel the pain. You start to lose range of motion, your restrictions, and different things happen before finally pain happens. And then it's like, and then it takes a lot longer to fix. If maintenance is, and it's just maintaining, just like we change the oil in our cars, we don't wait for the engine to seize, before we change. We want to maintain.
Correct. Yeah. So it's better to go and get myself checked and see how I'm doing, and then take it from there and just make sure I continue going as a maintenance point. And what would be like the main benefits that chiropractic treatment can give us on a regular basis, let's say?
Optimal health and wellness is what it comes down to. So many people live in pain daily, take Advil every day because of pain. So many people, they work all their lives and then they retire in their 60s, and then all these spinal conditions happen because they didn't take care of themselves. So we want to live in our golden years and be very mobile, active, and not be in a walker, wheelchair. I had a patient, one of my first patients ever. He was 88 years old. I'll never forget. He had Parkinson's, and I was a young guy just getting in chiropractic, and he shake because he had Parkinson's, but he was 6'2", tall, walked very well. He looked at me and said, "Son, I was seeing a chiropractor when you were in your diapers." So I says, "Okay." I did X-rays on this 88-year-old guy. He had no arthritis. He had been seeing a chiropractor once a month for his life and was very active, very mobile, even though he had Parkinson's. It was yeah. It just goes. You can be 80 years old but be active, but that takes maintenance through your life. And I think a lot more people are starting to realize that now. Rather than taking a bunch of medications, and by the time they're 67 years old, they have a list a mile long of medications, and then you have side effects from that. A lot of it can be prevented, through chiropractic, maintenance care.
Yeah, it's definitely to take care of it early in life. And what is your specialty?
So my specialty is sports injuries. I really, through my life, that's how I got into chiropractic. And I'm a professional bodybuilder. After I played college football. So my whole life has been involved with sports injuries. And that's kind of my knack. I used to own 3 gyms in the area, work out. I was a personal trainer 18 years. So I can really help people. When you can help professional athletes, you can help anybody, and I try to treat every patient I see like they're a professional athlete, in the sense that giving them the same care, the same treatment that they would get.
That's super cool. Wow, I've been doing that for 25 years. You must have had a lot of stories to be able to tell people about chiropractic treatment and how you help these guy or that lady. Do you have any particular story in mind that you think would be very interesting for people to know?
I do have a lot. Some of the best ones are my kids. Actually, believe it or not, I had a patient had she had a traumatic childbirth where the baby come out and it was stuck in the womb for a long time. Head was really crooked, had no feeling in the arm. The baby come out like this, and after months of physical therapy at the local children's hospital, the chief neurologist for the children's hospital referred me the baby. The baby now was about close to a year old for treatment, a chiropractic treatment, because he was not getting any results. And so I evaluated the baby, did a few adjustments, and 3 treatments later, full use of the arm. And I see that this child now, well, now he's 18 years old, and feels he's indebted. I'm indebted to him, but it's no big deal. It's amazing how infants and little ones respond so well to chiropractic, and it's a lot different type of a technique we use with kids. But to see the mom's face, when he's lifting his arm, she was in tears, and how much she realized her son. She was thinking permanent paralysis, and got full use of his arm, and his neck improved and everything. So that was one of my favorite stories.
Wow, that's so cool. Congratulations, doctor. Very well done.
No,
I know people are skeptical. Like, there's still a lot of people skeptical about chiropractic treatment, and they have like these
yes.
like weird ideas sometimes, or just wrong ideas due to lack of filling the lack of information with correct information. So, what would you say to somebody that is still skeptical about chiropractic treatment?
Well, most of the time, reason why people are skeptical is because they had a bad experience. And what I can say, just like any profession, there's good and bad. Some people get into the profession for the wrong reasons. For financial gain rather than for the love and the passion of chiropractic and what it can do. So that is what I'll tell people. Is like, one may not work, but there's not all the same. The other thing is the technique. To me, I believe chiropractic is something you're born with. It's something you have a knack to know how hard to push, where to push, so that you can help the patient. Whereas, if somebody does an adjustment and doesn't feel comfortable immediately, they don't have a good experience. Whereas I tell my patients, when you come to see me, you're either going to feel better or the same when you leave. Most of the time, better. Definitely not worse. If it feels worse, there's right there. So it's the art of, and you hear this a lot. Some people, they just love their chiropractor and think chiropractic is great because they have a good one and they really enjoy him. The other ones had a bad experience, and the other ones that are skeptical, that never seen a chiropractor, usually somebody told them something they heard. So the only thing I can say with that is, you can't judge something unless you try for yourself. If so many people through the years and said, I heard you're a good guy, you're a nice guy, and a lot of people referred, but I would never try chiropractic. And then I tried you, and I understand what they say now. They just didn't understand about when I explain it, and then the proof's in the pudding when I do an adjustment, and they feel immediate relief. It's like, okay, this works. So it makes a lot.
I do understand that they are like within the field of chiropractic treatment. I know that there are like different specialties, and that not every chiropractor is the same due to this. And that's something that a lot of people don't know or can't understand. And that's why sometimes it is hard to find the right chiropractor for, let's say, the situation that I'm running into, the thing that I want to get handled. So what would be the best advice that you could give us to help us find the right chiropractor for ourselves?
No, that's a very common question. So what I tell people is referrals. Referrals are the best. If you know a friend or a family member that has a good experience with a chiropractor, that's where we start. Okay, it does well rather than just picking in the book one, because there are so many different ones. The tech I use, and that's the variance of techniques is the big thing. I use traditional chiropractic, where everything's done with my hands. I do adjustments. Some doctors use instruments, and for me, I don't like to do that, but that may be something good for somebody else. So explain, have them explain the techniques that are used when being treated. Okay, and interview the doctor. I tell patients all the time, come see me, come talk to me. You ask me questions, and most of the time they feel comfortable and they say, okay, this is the right place for me. You can tell pretty quickly when a doctor's there to help you, or if he's not there for you to help. So
that's really cool. I think that's good advice. I've also I've spoken with a lot of chiropractors, and it's a very interesting field. And but let me ask you one question that I've actually had in regards to the community of chiropractors, because some of them say, oh, we are like lone wolves a little bit, it's kind of like each one of us is kind of like apart from the other. And some others say, no, we are actually a community. So I think that's very interesting. What are your thoughts about that?
Very good perception. So it's a little bit of both. The reason why is because chiropractic, we go into our own little clinics and we're our own doctors, and that's it. We don't go into a hospital, see other doctors and work together, in the same office. So in that sense, we're kind of alone. But a lot of chiropractors, especially in even my community, we call each other, we talk to each other, hey, what about this? What about this? We see each other out and about, and we're on the same page because we believe in the same things, have the same passion. And so it really is, we're all together as a team. But the isolation factor is because, we don't go into hospitals, and we're not around clinics, with multiple doctors. So it's most of the time we're on our own, and in our own clinics. So that's why it seems that way. But for the most part, we are a team, and we are together, and because we have the same beliefs, the same passions. And there's always going to be enough patients for all of us. If there was chiropractors every block for the next mile, there's still, we need to treat more people, because I think it's now about 25% of patients will seek chiropractic care, and it should be more to 100. So if everybody saw chiropractors, well, number one, that people be healthier, and people better without medications and less surgeries, and which is the ultimate. There's a time and need for medicine, but if we can avoid it, that would be great. If we can avoid surgery, that would be great too. And even your best medical doctor will tell you the same. Use me as last resort. Everything else first before you get surgery or become dependent on medication.
Yeah, totally. I totally agree with that. And there's also these type of episodes or podcasts directed to chiropractic treatment also allows us to help not only the general public but also other chiropractors, because like you say, sometimes they do have like a group of chiropractors that they stay in touch with each other, but not necessarily with the entire community sometimes. And I've found that some of the chiropractors are doing well, and it's very different. Like some of them have big clinics with a lot of staff, and they're treating like 50 to 100 patients per week because they have so many doctors. And other clinics are a one-man show, and they do everything. Like one doctor does everything from receptionist to actually delivering the therapy. So it's very interesting how on a field that is this important and this interesting, there's so many little differences and details. And this brings my question. You've been on this business for 25 years. You're successful. You've not only in regards to delivering the actual service, but also been on the administrative lines of running the clinic and keeping it alive. So your advice for other chiropractors on the administrative lines, like behind the curtains, what are the areas that you would say chiropractors run into trouble besides the therapy?
Well, I try to keep it simple. Keep your overhead low. What is our best asset? How do we treat patients? It's with these. You don't need big fancy things and big expenses. Keep it low. And the reason why I like to keep everything simple, low cost, because it translates into the patient. It makes it more affordable to the patient. I don't do any insurance in my practice now because, the insurance companies will tell me how I need to practice and not necessarily being the best benefit of the patient. So I want to treat patients to the best benefit. So I don't do insurance, but I don't have, the fanciest and, craziest office. I try to keep everything really low cost so that I can transfer that into the patient treatment. So now it's more affordable. I'd rather see more people and with for a lesser fee and have lower overhead. And that's, I think, doctors come out and they big expensive clinics. It puts a lot of stress on them rather than, like I said, all we really need is a bench in our hands and we got most of us the work done, and then staff, of course. As far as group practices, it's nice. And, I came out in my own practice. And one of the hardest things I do as a solo practitioner is if I need to take a vacation or something, go off, it's very hard because the patients are dependent on me. And if I have a sub doctor come in, they don't feel the comfort level of seeing that doctor after seeing me for so many years and this and that. So that makes it difficult as a solo practitioner. Finding an associate is hard because a lot of times if he's a good doctor and charismatic and passionate, he's going to want to open up himself, his own practice. So, but it's tough. And the best advice I can say is keep it simple. Get the necessities you need, nothing crazy fancy. Make it more affordable to the patient. And when I first started, I had a concrete floor, roller table, and one adjustment bench, and we see 40, 50 people a day doing that. So, because your hands don't need to rely on expensive, $100,000 equipment. Use your hands. What we.
That's really cool advice. Okay, good. And in regards to, let's say, other subjects like the administrative lines of getting in contact with the patient, receiving the patient, or the finances, or dealing with insurances, which of these subjects have given you the most problem in the past?
Probably staffing. That's always the hardest. But all I can say is once you find the right staff, you've got to pay them. Pay them because much. I tell people when I hire them, all I want to do is treat patients. Everything, the patient actually spends more time sometimes with the staff than with me. But my magic is in treating the patient. And I don't want to deal with finances. I don't want to deal with calling them. So finding the right staff and then paying them and then keeping them. That's the key, keeping them happy because they're so it's worth its weight in gold because it makes you able to focus on the patient and not have to worry about administrative things. There's always going to be administrative things, but you want to have your good staff that loves chiropractic, that really loves working for you, and takes pride in it, and I respect all my employees and I take good care of them. And in turn, they're really hard workers. I could write a book over 25 years of how all the staff that I've been through. And, when I write ones, I pay them well and I respect them and, compliment them and make sure that they're taken care of because it's so important. And I always see in my practice, if I don't have good front staff, that my numbers start to come down a little bit because, it's mainly because of my staff. So having a good staff is very important. That way you can focus on your patients.
Totally agree with that. Okay, excellent. Well, doctor, are there any additional health tips that you want to give the general public before we end off?
No, there's always people always see chiropractic, hear chiropractic. Now it's on YouTube and all these try it for yourself. Don't listen to what other people say. Experience chiropractic. Find a friend or somebody that can refer you to a good chiropractor. Go visit them. You'll be amazed how affordable it is and how much it can improve your health and well-being.
Absolutely. I totally agree with you. Well, doctor, thank you very much for all of this. I'm sure this is going to help a lot of people understand chiropractic treatment a lot better. And thank you also for the advice that you gave to other chiropractors, whether they are old timers like you, been on it for a long time, or guys just starting up their own clinics. I think that advice was fantastic because those subjects I've heard that they give trouble. So hearing those words from you, I'm sure that they will get inspired. And thank you very much, Doctor. So please tell us, how can people contact you?
So best is my website. It's www.drdjax.com. So drdjax.com. The phone is 904-223-1616. But drdjax.com and all the information. I have videos and explanations. It's a very informative website.
All right, that's cool. So people, they should check it out. I'm sure you're gonna get blown away with Doctor because he's super cool and he knows his business. Like you can tell he's got heart for what he does. I congratulate you, Doctor, for everything that you do. Keep doing it, and please help me say goodbye to all the people who are going to be watching this. This was a fantastic interview.
Thank you, sir. I really appreciate it.